What's up, everyone? Welcome back to another episode of Amplify. On today's episode, I want to talk to you about my experience doing 2 rounds of egg retrieval and egg freezing. So I'm going to back up a little bit and give you kind of a high-level timeline of things. So in 2020, I decided to end my 5-year marriage. It was a 10-year relationship in total. And so therefore, in 2020, I became single. Now, with my ex-husband, we had never tried to get pregnant, though that was something that was definitely part of our vision together as a couple during our marriage, but we never got to the point where we were trying or anything like that. So kids, while yes, was part of the plan together, we didn't step into that chapter of our lives together. And so I became single, as I said, in 2020 and, dated, lived my life, all of that. And overall, very, very healthy. In 2020, I started seeing a new OBGYN who I absolutely adore. Her name is Dr. Shamsa Amersi here in Los Angeles. And I'm also going to share all of the providers that I used for my egg retrieval and everything like that, because I highly recommend everybody that I worked with and everybody that was involved in the process. I had an overall great experience. And why I'm sharing this and why I'm doing this episode is because I've had so many of my friends and even people in my community, my audience, ask me questions about this because it's things that they're considering for themselves as well. And I think there's a lot of conflicting information out there, and there's a lot of fear mongering, I think, as well with this. So once again, this is just my personal experience, but I think it can be helpful to hear. So with my OBGYN, Dr. Amersi, when I started seeing her in 2020, I had been about 5 years off of birth control, after I got off birth control, I got off birth control when I got married, and I got an IUD. And when I went off birth control, and I had been on the birth control pill for the majority of my life, from when I was a teenager to help me regulate my period, and then until literally age 30. And so when I went off of birth control, I started getting really bad hormonal acne. I had never in my entire life dealt with acne, dealt with issues with my skin. And if you don't believe it, at some point, I'm going to have to share pictures because it was shocking. And so after that, and I wasn't seeing my current doctor at that time, but after that, while I'm dealing with this crazy skin situation and everything like that, and it was honestly pretty devastating as somebody who has never felt self-conscious about their face and never had to struggle with anything like that. It was really, really hard to go through. And so I ended up getting really high quality prescription skincare products. And I also went on a prescription pill for my skin called spironolactone, which is an androgen blocker. So when you're on the birth control pill, generally you're getting, getting fed estrogen. And so it's artificially, or chemically, if you will, pharmaceutically elevating your estrogen levels. So when you get rid of that, your body hasn't been producing that amount of estrogen in the same way. And so even the smallest changes in your hormones can create a lot of crazy side effects, right? And so what spironolactone does is it suppresses any additional testosterone, or it helps balance out those levels more. Because it's not like I was had an unusual amount of testosterone or anything like that, but because from birth control, my estrogen levels were my body was so used to having that extra estrogen being put in, right? That once that was gone, one of the side effects that I experienced was really, really wild hormonal acne. So the spironolactone, and this was after months of trying a lot of topicals, adjusting my diet, so many different things, I went on the spironolactone, and within a couple weeks, my skin started clearing up. And so I was on that medication. That was the only medication that I was on. I was on that for years, health vitamins, that sort of thing, but spironolactone for my skin for years. There was another drug that I tried when I initially I forget exactly what it was. It was a low dose antibiotic that was supposed to help with skin as well, but I was only on that for a little while. I forget the name of it. But anyway, so I was on spironolactone for years. This is going to make sense why I'm backing up so far. And so when I started working with Dr. Mercy, she was like, hey, my preference is to get you off of spironolactone because I love that it helped you. But what that's telling me is that there is an underlying issue going on. There's something that's out of balance. And I think we can fix that so you don't have to use spironolactone. Because she's like, because when you want to get pregnant one day, you're going to have to stop using spironolactone. And she's like, I would rather we figure out what's going on now and find a solution so that you don't have to keep taking this. Because at some point, you're going to not be able to take it anyway, right? And I'm going to be perfectly honest. When she first had that conversation with me, I think I maybe cried at the doctor's office because I was so traumatized from when my skin got so bad without it, right? And so I was I thought so dependent on this medication to keep my skin clear. And thankfully, my doctor, she recommended we did a lot of like hormone testing, blood work, everything like that to understand what was going on. And she recommended a couple vitamins, supplements, that sort of thing. Nothing requiring a prescription, nothing I needed to do with my skin. And it solved the problem. And I have never since then had any issues with my skin. My skin has been, in the last 5 years since making that change, my skin has been better than it's ever been in my life. I mean, if you were watching this on video, not to yes, actually, to show off my skin. Yes, I'm wearing makeup, but also like I am so proud of like how I've taken care of my body and gone a really natural route. And so I say that because Dr. Mercy, my OBGYN, I absolutely adore her. She approaches things with a very balanced, holistic perspective. She's incredibly intelligent. She is so kind and so nurturing. Like I've always felt so understood, like I can ask any questions. And also like I met her and became her patient when I was right after I ended my marriage, right? So while I was going through this major life transition and was like figuring out how to be on my own again. And so there are plenty of moments when I have cried at the doctor's office with her, and she has always been nothing but kind, informative, helpful, and just lovely. Just lovely. And I completely trust her. And I also have like such experience with her being right, but also with like, let's get to the bottom of this and figure it out. And based on how effective her guidance and her feedback was, like I trust her so much. And so that's part of my point with sharing this, and highly recommend her. And so that was kind of the start of our journey together. And as you may know, if you've been listening to the show for a while, in 2022, I got unexpectedly pregnant, ended up the pregnancy was not viable, ultimately not viable. And I ended up starting the process of having a miscarriage, and chose to do a D&C. And this isn't the episode to talk about all of that. But yeah, that was a really intense, really traumatic experience for me. And with that too, even through that, very much trusted her guidance and her support and how she presented all of the information and options to me. And so after 2022, because of that situation, I went to the doctor very regularly, like every couple months, just to make sure my body was bouncing back appropriately. My hormones were getting back to normal levels, all that kind of stuff. And because she knows that I want to have children one day, and that's really important to me, and she knows that I also was and am single, she wanted to make sure that my body was recovering effectively and in the best shape and health as possible. And so we would do blood work a lot and just all the things just to see how everything was going. And there was one point, I think it was probably the end of 2022. As I'm navigating this, I just had that experience in the beginning of 2022. She recommended, hey, like on the plus side, right? This shows that your body can get pregnant, right? Like, yes, it ended up not being a healthy, viable pregnancy, but the great thing is, like, yes, you've never tried to get pregnant before, and obviously you didn't try to get pregnant this time. She's like, but the good news is your body can get pregnant. right? Great. And I'm like, yeah, great news. It was a super fun experience for me. And so that was kind of, like a silver lining with it. And she also said, and because you're in your mid 30s, like I recommend like maybe you look into egg freezing and egg retrieval so that you don't feel pressure while you're dating. And she's like, because I would hate to you one day find your dream person and then have trouble getting pregnant. And she's like, and this can be something that kind of provides a safety net. She's like, I don't think that you'll need to do it, that you'll need to use these eggs for your first pregnancy, probably not even your second pregnancy, maybe second, but maybe third. She's like, but it's something that I recommend you look into just for peace of mind and just in case, right? And she's an incredibly well-respected and successful and like well-known fertility doctor as well, or like specializes in these things and is again, I could not say like more wonderful things about her and how much I trust her and everything like that. So that was something that she suggested I look into and consider like in the end of 2022. And obviously that year had been quite traumatic for me as far as pregnancy and like just hormones and my body. And it was a very big, intense experience. And it took a lot of time. It took a lot of time to get my body back to feeling normal, because even if I was only pregnant for 5 weeks or so, your body, right? Like once that's not the case anymore, your body was still prepping for a lot and doing a lot behind the scenes, if you will, or internally. And so it takes time for all of that to slow down, all of that to stop, and for your body to get back to normal. And so when she recommended I look into egg freezing, my initial thoughts were, oh my gosh, one, I do not want to manipulate my hormones. Like it took a lot of work to, once I went off birth control to like figure out that stuff with my skin. And also like she and I had worked really hard to like figure out what balance of supplements and stuff to like keep things really smooth. And then I just went through this big experience and I'm finally kind of feeling back to normal. I was like, I do not want to do something that's going to like fuck with my body and with my hormones. And I was just so scared of and so like didn't want to like put hormones into my body. Like I also am somebody who I eat very balanced. I'm relatively quite healthy, but I do enjoy eating, right? I don't eat perfectly or anything like that. I enjoy living my life and having the experiences and all of that. But I also am somebody that like I take healthy, natural supplements, and like I will rarely have like Advil or ibuprofen, right? Like I think I do something like that like twice a year. Yes, I get Botox and stuff, but like, yeah, I'm choosing my battles, right? And so I want to put like as little chemicals in my body as possible. And so for me, when she and I had this conversation, I was like, oh, I really don't want to mess up my body. Like these last several years have been a lot of work to get to this place where it feels really good. And then of course had that, had the pregnancy that really threw things off, of course. And then it took a lot of time to get my body feeling good again. And so I just didn't want to go through something that would mess with my hormones again in such a dramatic way, or so I assumed, such a dramatic way, right? And then the other thing too was the cost of it. And so I didn't exactly know how much it would be or anything like that, but I just assumed that it would be really expensive, right? Because I know that egg retrieval and egg freezing is generally like $10,000 to $15,000 per round, right? And it's not always something that's covered by insurance. So she recommended that I call my insurance and see what my options were, what the coverage was. And so I called my insurance at the time. And I then, and still as I'm recording this, have United Healthcare. And so when I called them to ask about the insurance coverage, it wasn't like, it was good, but not that great. And I also didn't like completely understand it, I don't think. So I thought also like, oh my gosh, this is going to end up being something, if I choose to do it, that's really expensive also. And so I was like, I don't want to fuck with my body. And I also don't want to pay all this freaking money to fuck up my body right now, right? And so when she and I first had the conversation, it was really like, I didn't want to do it. My gut, my intuition was like, nope, don't do it, don't do it, don't do it, don't do it. And so I didn't do it. And then about a year later, she brought it up to me again. So this would have been like probably summer 2023, I would say. So about a year ago, she brought it up to me again. Hey, have you reconsidered? And I want to really emphasize that anytime she has suggested something like this to me, she does it in a way that is, yes, with her level of authority and expertise as a very experienced, very knowledgeable doctor, right? So she's clearly holds that authority and that experience. And also the way she presents it is with such care, with such openness, willing to answer any questions, willing to entertain like any stress or concerns, and never in a pushy way, right? Never in a way that, even though, yes, she knows so much more than me, right, about this stuff, of course, but I never felt like I was being spoken down to or anything like that. And so she would present this like, hey, have you looked into, or like, where do you stand now with egg freezing? Have you thought about that again? Where are you at? Right? Very open, very compassionate. And so last year I was like, actually, I think maybe I'll look into it again. I feel more open to it. And it was a very intuitive thing of my body just being like, yeah, maybe we're open to this, right? Like I didn't feel as much of the hesitation around manipulating my body with hormones. Like I was like, you know what? Like I'll be fine, right? I think just in 2022, I had gone through so much that it was like, I don't want to add another thing, right, to the mix. And so I decided to look into it again. I was like, let me call my insurance again, and just to get refreshed on the details and the coverage and everything like that. And so when I spoke to them this time, when I called United this time, they were like, oh, and by the way, with your plan, you have supplemental coverage with Progeny. And interestingly, the year before when I called them, they didn't mention that. And also, like, I mean, it's my insurance. I should know my benefits and all those kind of things. I didn't know, right? Like, and I have excellent health insurance. I have excellent health insurance and a lot of perks and things like that. And so when I first called them, I figured they might, if they're aware of things that are included in my plan, they would probably tell me. And so when I spoke to them this next time, right, in summer 2022, I think, summer 2023 or early 2023, they were like, oh, by the way, you also have Progeny coverage, which is going to like cover things considerably. And I was like, oh. And so what I learned, and I'm going to talk about the costs and the insurance in a moment as well, but what I learned was that with my United Healthcare coverage and my Progeny, and Progeny is specifically a fertility supplemental insurance coverage. So with my United and Progeny, that ended up making my overall cost, making the whole process covered at about 90%, which is amazing. So for me, it was like, oh, wait a second. One of my concerns was that this was going to be a big investment, and a big investment that I didn't feel like I needed. So when I was thinking about the cost of it before, it was like, yeah, but this feels like a waste of money because I don't think I'm going to have to use these eggs to get pregnant, right? Like, I think it's going to happen for me naturally, and it's going to happen just fine. So I feel like this is probably just going to be a waste of money, right? And I wasn't in a place where I just wanted to throw $10,000 or $15,000 at like a just in case, right? And so once I learned in 2023 that actually my coverage covered a lot, right, and nearly the entire thing, I was like, okay, well, my concern about the money is no longer a concern. And so I'm like, and I'm feeling more open to like trusting that my body is gonna, like, we're gonna bounce back just fine, like it's gonna be fine. And so I was like, you know what, I think let's go ahead and do this. And so some of my reasons too for being more open to it were like, for the last, in 2023 and this year, 2024, I have been very ready for my life partner. I absolutely want to have children, all of that. I'm in my late 30s and very open and ready for that. But also was this feeling like time is running out. Time is running out. Where's your husband? You need to meet him now because you have to have children, blah, 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 all this kind of stuff. And so part of it for me, and I was dating and I've dated some really wonderful men, but men that they're not it, right? Like they're not my forever. And so part of this decision for me was to take pressure off of my dating life, right? I didn't want to go into a dating experience being like, are you it? Because if not, get the fuck out of here, right? Also once I determine if somebody's a no for me based on what I'm looking for in as far as a life partner, right? I don't continue things, but I also wanted to take some of the pressure off of my dating life, right? And not feel like I'm racing against the clock and everything like that. And I will say that doing this absolutely did that for me, right? It has been so helpful to take a lot of that pressure off so that I could prioritize a connection with somebody that feels really, really right, right? Rather than having to jump into something because I'm scared of missing a fertility window. And again, like even with doing the egg retrieval when I did it, same thing. Dr. Mercy's like, I really don't think that you're going to have to use this for your first pregnancy and maybe not even your second. If you want to have 3 babies, maybe for your third, or maybe you'll need to use it for your second, but it was much more of a backup plan. And when I told her that I was going to do it, she was like, I think this is the right choice. I'm really excited for you, proud of you, like, great. And so she recommended that I work with the Southern California Reproductive Center and specifically Dr. Hal Danzer at SCRC, so Southern California Reproductive Center. And I highly recommend. I had an incredible experience with Dr. Danzer and his team. Everybody is lovely. Everybody at SCRC, the location is in Beverly Hills. I believe they also have a location in Santa Barbara and a few other places. I went to the Beverly Hills location. They were wonderful. Like they have that fertility center working so smoothly. Like it is a machine, but not like in a like unfriendly, like cold, sterile kind of way, right? They have things working so smoothly. They are so on top of it. It was really actually quite fascinating to like learn the whole process and everything like that. It was very cool. And I highly recommend Dr. Danzer at SCRC. And so one of my other providers that I worked with there is Dr. Jennifer Schulman, who is the acupuncturist there at SCRC. She also has her own private acupuncturist practice, but she's their in-house acupuncturist as well. And so before I move on and talk about like the prep ahead of time and the process and all of that, I want to make sure I cover the insurance and cost and stuff again, just in case I, get all those details out. So as I said, my coverage is United Healthcare with Progeny as a supplemental insurance. I don't know what the other supplemental insurance options are, but worth looking into, right? I was very pleased with Progeny, with their customer service, having the medication get delivered and dropped off at my house, like all of that. It was a very smooth experience. And again, generally, I would say egg freezing, like one round of egg retrieval and freezing comes to approximately $10,000 to $15,000, but I would say more likely to $12,000 to $15,000. And mine was covered basically 90%, if not a little bit more. And so I ended up and I did 2 rounds of egg freezing. I did a round in November 2023, and then I did another in March 2024. And I ended up paying about, I would say, $1,000 out of pocket the first time and about $2,000 out of pocket the second time. And the change between the first time and the second time is I think something did adjust slightly in my insurance based on it being a different calendar year. I don't know if it was like because of deductible or what, but I also did some different medications the second time, which would have increased the overall cost. So because like with this stuff, like each kind of but each prescription, each medication that you get is about $125, right? So this stuff adds up really, really quickly. And then of course the procedure and everything like that. So all the things now I'm going to move on to the prep. So like the pre-hormone prep before you get started, anything like that. So when you are starting the process, you go in to wherever you're going to have it done, or at least this was my experience, and they're going to do an ultrasound and also draw your blood and check your hormones, right? They want to see how your follicles look in your ovaries. They want to see how your blood hormones, like all of that. And so And for myself, like I've worked really hard with Dr. Mercy to get my hormones in a really awesome place. I do on a regular basis do a progesterone supplement, like a topical supplement, just to balance things out because my progesterone can be a little bit low. But so anyway, all that to say, you go in the beginning and blood work, ultrasound, so that they can see what they're working with, right? And then they plan your personalized approach based on how things are looking and based on where you're at in your cycle as well. I'm kind of forgetting exactly, but I kind of forget when exactly you go in relation to your period, but yeah, I don't remember. Anyway, so I also, for my first rounds, like I wanted to make sure that I was, well, and for both rounds, but I wanted to make sure that I was doing everything possible to produce the best results because this is expensive, it's time consuming, it's a lot of strain on your body, it's going to throw off your natural hormone balance, like obviously. And so I wanted to make sure that I was doing everything that I could on my end to ensure the most successful and like ideal process, right? And so I had a call in the very beginning of the process with Dr. Schulman, the acupuncturist, and she's awesome. She's so cool. She's so cool. We like have girl talk anytime I would go in there and like, all this stuff. And she's amazing, so informative, so helpful. She also like incredibly knowledgeable about all of this stuff. I mean, she's been doing this for quite some time, so she's incredibly experienced as well. And she would also give me another perspective if I would be like, oh yeah, the doctor said this, or the doctor said this, or they like, here's where I'm at and things. And she would be able to translate a lot of that information to me in a way that made a lot more sense too. So I really loved having her perspective as well. And she's like no nonsense, very open, very honest, but really enjoyed working with her as well. And so some of what she recommended was to do acupuncture 1 to 3 times a week leading up to egg retrieval. And so when I started the process, I started doing acupuncture about a month before I started doing the hormones and everything, just to get everything as like primed and yummy and beautiful as possible. And so a few of the interesting things that she told me to promote the best egg health are as follows. I'll give you kind of a list of the like, yes, good egg health. This like these following things make for very happy eggs. So she recommended I start taking a CoQ10 supplement or ubiquinol supplement, which helps to increase your AMH levels. She recommended 200 milligrams 3 times a day. And I also want to be very clear. Once again, all of this is my personal experience based on my unique body, right? My unique body and where my hormones and like body is based on my age, like all this kind of stuff. So anything that I'm telling you, like as far as certain medications, like these are specifically for me. So none of this is like, obviously, I hope none of this is medical advice or recommendations or anything. I'm just being as transparent and upfront with what my experience was like as possible. So as I mentioned, she said to start taking CoQ10 or ubiquinol to help make those eggs happier. She said no intermittent fasting. So one of the things that I learned about our eggs is our eggs like to be very comfortable without really extreme things happening, which makes sense, right? I think the eggs are little princesses in there, right? Like, or little princes, right? But they want to live this very luxurious, very comfortable life. And so you'll notice with the things that I'm sharing, like they don't want extremes, right? Okay, so we've got the CoQ10 ubiquinol, no intermittent fasting, right? They don't want to fast. The eggs do not want to fast. They want to be fed when they're hungry. No HIIT workouts. So again, the like high intensity is not, the eggs don't want that. They don't want high intensity. No hot yoga. Don't want to get too hot. And not a lot of sweating. So again, we want to, for like optimal egg health, the eggs want things steady. That's one of the things I really learned. The eggs want things steady and peaceful, right? She recommended I get 10 minutes of morning sun each day, right? Like get some good vitamin D, get that circadian rhythm flowing, like all of that. And that's something that I already do every day anyway. So that was very easy. She also recommended no raw foods. That was one that really surprised me because I'm like, excuse me, like what? No raw foods? Why? Isn't that healthy? Like not a bunch of fruit, not salads, things like that, and to mainly eat warm foods. Again, because once that food's in the body, it doesn't like I think part of it is the temperature change and stuff like that. Like they want to be comfortable and relaxed in there. She recommended I have chia seeds, sunflower seeds, walnuts, sesame seeds. So I did. I also, like, the entire time I was doing fertility treatment and like leading up to it, I was doing seed cycling, which I highly recommend. And so with seed cycling, what that looks like is on days 1 through 14 of your cycle. So during menstrual and follicular phases of your cycle, you want to promote more estrogen production. So things that are good for that seed wise are pumpkin seeds and flax seeds. And then during day 15 to 28, which are your ovulatory and luteal phases, you want to promote more progesterone. So eating things like sunflower seeds and sesame seeds are really supportive for that. So I was making sure that I was seed cycling every day, right? Like I was having my seeds in my yogurt every morning and really like sticking to that to support healthy hormone activity through my food. She recommends lots of berries, which I'm going to assume for like antioxidants and stuff like that. Like berries are so good for you. Again, something that I already was doing quite regularly. She recommended lots of avocado, getting those healthy fats in, lots and lots of water. She also recommended, because I was very honest with her, because again, I wanted to have the most successful experience possible and have the best results possible. And so I'm asking, I'm like, okay. Also, I occasionally use cannabis, and I also occasionally do some psilocybin and microdosing. And she said, you know what, like no more cannabis, no more weed, because we know that that's going to like affect things. I was like, okay, easy, no problem. And she's like, we don't really know exactly how psilocybin affects things, but to be safer, let's not. And so I was like, okay, no problem, right? And so keeping things clean. I personally don't drink alcohol like at all. I think, so I had a glass of wine last weekend and I can't even remember the last time I drank. I think the last time I drank would have been like a cocktail in September on a date. So like I drink very rarely. So also one of the things to recommend is no alcohol, right? I think she even said something like a certain amount a week or something like that. But I was like, dude, I don't drink at all. So we're good. I'm not going to drink for this. So that's something I would probably recommend too, because alcohol is definitely not going to help things. She also recommended I start taking a prenatal and said that eggs and bone broth are very, very good. So that was all my prep, right? Not doing HIIT workouts, not doing intermittent fasting, making sure I'm getting plenty of sleep, making sure I'm eating all those things, staying really hydrated, like adjusted my workouts, making sure I'm not. And also another thing is like no sauna and no hot tubs. Again, you don't want to like be cooking your eggies in there, and like no cryo, no ice baths, that sort of thing. You don't want to be doing super dramatic things with the cute little eggies, right? So I did acupuncture a couple times a week before I even started with the hormone injections, as well as like making all of those dietary and physical adjustments as well. And then we shift into the actual like hormone process. And so I honestly like had no idea what this whole process looked like, right? Like I really had no idea what I was in for. And so yes, I spent about a month doing all that prep work before anything. And like, you know, you go in every once in a while to the fertility clinic so that they can check your hormone levels and look at your follicles just to see where things are at. But once I got started with my first round last November, I told my doctor, so Dr. Danzer at SCRC, I told him, I was like, you know, I'm like, I would really prefer to not have to go on birth control in order to do this. So if you think that based on what you're seeing, it looks okay and I don't have to do birth control, that would be my preference. I'm like, but if you feel really strongly that the birth control will make a big positive difference, I'm okay to do that. But just know like my preference is as minimal like hormone intervention as possible. And so the first round, he was like, you know what? I think that's totally fine. I think that's totally fine. So a common step that they do with this process is you will go on birth control for like 30 days or 2 weeks or something like that, because it ends up getting all of your follicles, which is where your eggs are developing. It gets all the follicles developing on the same schedule, right? And it syncs them up, which is going to be more helpful with the retrieval process. Because something that I learned, which was, and again, this process was so fascinating. Like, I learned so much more about my body and just being a woman. It was really, really cool, I think. And so one of the things too, like, as they're doing this, like, once you start with the drugs, like, you're going in very regularly, like every other day and sometimes daily, so that they can do blood, do an ultrasound to see exactly what's going on in your body on a day-by-day basis, and to see exactly how the drugs and the hormones are changing things, because they make adjustments on like a day-to-day basis based on what's going on, based on your real-time feedback in your body, right? And so I just found that to be super, super fascinating. So that usually most people start with some birth control. Like I said, do birth control priming to get things synced up and kind of on a similar schedule and stuff like that. And then you generally have the injections and shots, hormones. And that can be, I know it's going to differ for every person, but I think generally it's like a 1 to 2 weeks, that you're going to be doing shots before you have the retrieval procedure. And so round 1 for me, like I said, I didn't do birth control based on my request. I was like, I just really prefer not, like, I want to do as little as possible. My doctors thought that was totally fine. And so I ended up doing 9 days of hormone injections before my retrieval. 9 days. It was so much faster than I thought it would be, to be perfectly honest. And I'm going to tell you the drugs that they had me on. Again, not that they're going to be the same drugs for every single person. Again, this is very like customized to your body. I'm sure like a lot of these are the same drugs that everybody uses, but again, want to be really, really clear. These are the things that I specifically used based on the feedback my body was giving. So I was doing the Gonal F and Menopur injections. And then after a few days of that, we added the Cetratide injections. And then once they feel like things look good, right, look best as possible, and they feel like you're ready to go, you do injections that will trigger ovulation. And so in my first round to trigger ovulation, we did Novarel and Luperon, I believe was the name of those. And then once you do the trigger, like literally like the next day or 2 days later, you have the procedure. And so I don't know exactly like the exact purposes of each drug, right? But the goal is to have your follicles, as many follicles as possible, maturing at similar rates, right? And so that's when you go in. So once I started the injections, and like I said, I did 9 days of injections, you go in the beginning, every other day, or like almost every day. So almost every day for that. In the beginning, it's like every other day. And then once it starts getting closer, you're going in every day so they can check on things. And so part of what the doctor is looking at is, okay, how many follicles did we start with? And how are they maturing and developing, right? And they determine when to do the trigger shot, when to trigger ovulation based on what they believe. And again, this is very much paraphrasing. I'm not a doctor. They do the trigger shot based on the time that they think you have the most mature eggs available to retrieve, right? So they're trying to see like, okay, because some are younger than others. Some are going to mature too fast, and then those aren't good anymore. Some aren't going to mature fast enough. And so it's not like, oh, if I have 15 follicles in there, then we're going to get 15 out. No, like they're all kind of on their own schedule. And so the goal of all of these medications is to get them to develop in a healthy way, right? And to have as many developing on the same kind of time frame as possible so that you have the best chance to get the healthiest out for freezing. And so once you do the trigger shot, you go in and you have your procedure like the next day. So those 9 days or 2 weeks, once you start the injections, you need to be very available with your schedule. Because when I was doing the injection, so as I mentioned, like the month leading up, I was doing acupuncture. So I was going to acupuncture appointments a couple times a week. And then I had a couple appointments, at the doctor so they could see where things were at and when we wanted to start. But once you start doing the injections, you need to be very available, right? For a few reasons. There are certain injections that you're going to want to take at certain times. All of mine I did at like 10 p.m. at night, right? Because I knew I would be home. I knew I would be getting ready to get into bed. Like if I went out to dinner, and I got home at like maybe 10:30, that's not too late, right? But generally a time when I knew I would be home and able to do the injections. But you also need to be available because you need to be able to go to the doctor to have them check and see how you're doing. And like, it's a lot, right? It's a lot. Like, and specifically for me, like living in Los Angeles, that's like a 30-minute drive to the doctor's office, 30 minutes home. But I will say, like, when I was there at Southern California Reproductive Center, like I said in the beginning, like the way that they have their system worked out and everything, like it is such a well-oiled machine. One, like their building and their office is really beautiful. It's really beautiful. Everyone who works there was so lovely. And like they get you in and out. So like when I would go for blood work and ultrasound, like I wouldn't be there for more than 10 minutes, I think. Usually it's like 5 minutes and you're done and on your way back home, right? And it was very rare that I would ever have to wait also. Like every once in a while I'd wait for a couple minutes in the waiting room, but usually like I said, they've got this thing down. But at the same time, right? Like I would have to drive, and thankfully like that's, this being in Beverly Hills is actually quite convenient for me because I know a lot of people were driving from like Orange County and stuff like that. And so that is something that you need to plan for, right? Because spending over an hour driving to and from a doctor's appointment, if not more, right? That's a chunk out of your day, right? So it's something when you're doing the injections, like that is your priority that week or those 2 weeks. That is your priority. And so once we did the trigger shot and I went in for my procedure, my mom ended up coming into town, or she was already in town visiting me, and it just worked out that the timing like was exactly right for her to be able to like take me to the doctor, take me home, take care of me, all of that. And so when you go in for the procedure, it's a surgery. It's a surgery. And so and I believe this is how it is everywhere, right? But I was completely under, so general anesthesia, completely asleep entirely, right? They go in through, which I think is obvious, but I'm going to be really detailed with this. They go in through the vagina and they very gently extract the eggs. Now, obviously you're completely asleep. You don't feel anything, nothing like that. And while yes, that's invasive, it is very minimally invasive, right? You don't need any stitches. You don't need like nothing like that. And the procedure itself is like a 15 or 30-minute surgery, right? But you expect to be there for a couple hours because, you're going to have to fill out a bunch of paperwork. You're going to have to wait. You got to get checked in. You're going to need to recover, all of that. And I will say also, and the surgery center at least for Southern California Reproductive Center, the surgery space is in the same building. Everywhere that where I was going every single day for ultrasound and blood work, that's the same place I went for surgery, right? And you do need to make sure you have somebody that drives you there and somebody that's going to take you home. And like ideally that person should wait for you because again, it's a pretty quick thing and because you won't be able to drive. So yeah, the process, like I said, like all the staff there, the nurses, they were wonderful. They were lovely. The anesthesiologist came over and connected with me. And the day before surgery, the anesthesiologist would connect with me over text. Hey, just letting you know I'm your anesthesiologist. They, ask any questions they have. Like super, like everyone was so professional, so kind, so helpful. Like I said, incredible experience with everybody. And so, yeah, so the procedure went super smoothly, super easily. And I think even it's the same day or the next day. I kind of forget exactly, either later in the day or the next day, Dr. Danzer calls me to let me know how things looked, right? And so for my first procedure, We ended up getting out 10 eggs. 6 of them were mature and like in good shape to freeze. And so the other ones, the other 4 were immature. And so they just didn't mature in the time frame that we needed. So they don't get to go in the freezer. And so this is where, and we started with 15 follicles. So we started with 15 and we got 10 out. So that means 5 of those like just matured faster, right? And then left, right? They died, if you will. Well, technically not, but I don't know what the word is for it. So we started with 15, 10 were able to be retrieved. And of those 10, 6 were able to put in the freezer, right? So that's like pretty low if starting with 15, though that wasn't bad. But now here's an interesting part, right? And I didn't know this going into it. So Dr. Danzer calls me, tells me all of that. I'm like, okay, great. And then says, and I also want to say too, Dr. Danzer, very knowledgeable, very kind. I can tell that he has done this so much and he really knows his stuff, and like such a kind human and wonderful to talk to anytime I spoke with him, anything like that. So what they do after that, at least here at SCRC, is they plug your certain details about you, like your age and certain like health metrics or whatever. They plug it into an algorithm, also based on like the number of eggs they get. And it will give you a percentage of like, what's the likelihood of a full-term live birth from the eggs that you retrieved. And so Dr. Danzer, when he calls me, he's like, all right, Lauren, we got 10 eggs out, 6 were mature, the others were immature, so they weren't able to mature, so we couldn't freeze them. But great news, we got 6 eggs in the freezer. And then we also, and he's being very informative with all this stuff. He's like, and based on those 6 eggs going into the freezer, he's like, that is a 35% chance of a full-term live delivery, live birth. So that those 6 eggs, those 6 mature eggs in the freezer gave me at that point, based on my age and other factors, though I'm going to be real, I'm freakishly healthy. I'm in amazing health for my age and all of that. So I think my calculations in the algorithm would be a little bit higher than that. But also, I like a realistic perspective, right? And so he says that. He tells me there's a 35% chance. And I literally said this to him. I was like, 35% chance? I was like, Dr. Danzer, that's not very good. I was like, that's an F. Like, that is not very comforting for me to hear. He was like, no, it's okay. He's like, that actually is really great. He's like, but I do recommend for like increasing your chances, I recommend we do another round and, so that we can get that number higher. And I was like, yeah, absolutely. I'm like, cause I didn't just go through all of that to have like a 35% chance of a baby with this insurance, this backup plan. Like, this is supposed to be the safety net backup plan just in case. And 35% does not make me feel confident, right? I wasn't that sassy with him. I said what I said initially of just being like, whoa, that's not very good, right? And so he's like, okay, great. He's like, get in touch with us, call the office at your next period. And then we can come in and do some blood work and things like that. And we will assess things from there and everything. And so one of the things too, you don't do it back-to-back months, right? You want to give your body a little bit of rest in between. And so when I did round 2, which as I mentioned was March 2024. So my first round was November 2023. I waited a couple months and then decided, okay, let's do round 2. And for round 2, I said, you know what? I know last time we didn't do the birth control priming, but I'm okay with that for this round. If you think that it's going to improve the results, I'm open to doing the birth control to lead up. And so that's what he recommended. And so I think I was on birth control for a month. And so that's part of why, the next round the next retrieval was in March, because I think in February I ended up getting on the birth control. And so the funny thing about this is I'm taking the birth control, all of that. And I'm already like, I hope this doesn't fuck with my hormones. I don't hope this doesn't mess up my body or whatever, right? I'm kind of not having an amazing attitude about being on birth control. But again, was like, I'm open to it if you think it's the best option, right? Well, my friends, my body fought through the birth control and ovulated anyway. So what that means is the birth control did not have the desired effect that it was supposed to have, right? And as I mentioned, one of the reasons for the birth control is to sync up the follicles and get everything on a similar schedule. So again, as they're maturing, you get the highest number possible at the same age or maturity level so that you can take out the most possible to freeze. And so my body fought against the birth control because she's so strong. Fought against the birth control, ovulated anyway. So the birth control did not have the desired effect. And I ended up having like a second period as well. Like it was just really all over the place. And I remember having a conversation with Dr. Danzer because I went in to like check blood work and check hormones. And they're like, based on the blood work and everything, it looks like you ovulated based on the numbers we're seeing, which is not what you're supposed to do when you're on birth control, right? Birth control is supposed to stop ovulation. And he's like, so it didn't work the way that we wanted. I cried. I cried on that phone call. Because I was like, again, the birth control wasn't something that I was really all in on. And so I was like, okay, if you say so, if you think it's going to be a good idea, I'll do it, right? And so when he was like, yeah, it didn't seem like it worked, I start crying immediately for a few reasons. Because also, keep in mind, I'm on a bunch of hormones now that my body's not used to being on, right? Like being on birth control is not something like, so I'm more emotional just from that. I'm a little more tender. I'm a little more sensitive because of the drugs. And then I hear that, oh yeah, and these drugs that you didn't actually really want to take in the first place, it didn't work. So that ended up meaning that the month was kind of wasted. That not only was that hormone manipulation wasted, right? It was a waste of effort, but the time I took to take it, like the month of doing that, because I did that in preparation for the shots. So the month of doing that means that that time was lost too. So I cried on the phone call. I was frustrated, right? And ultimately though, it actually probably helped with the results. When I was speaking to Dr. Schulman, the acupuncturist, and I told her this, and we were like, because she also has access to look at where things are at and stuff like that, because, you know, she's part of the team to help the fertility team. And so she would look at things. She's like, she's like, honestly, I know that the birth control didn't work the way that they wanted it to, but she's like, I really do think that it helped to get everything on the same page. Like, she's like, I really do think that. And I believe it. So anyway, actually, I need to back up a second too, because since I did the birth control, I had to do a couple injections to induce ovulation so that we could know for sure that I ovulated, right? So since I was on the birth control and my body was fighting against it, my blood work indicated that I had likely ovulated, but in order to be sure, I had to then do injections to force ovulation to basically like clear everything out so that we could start with a clean slate essentially. So it was a whole month and like a whole bunch of drugs that in my brain, I was like, this was unnecessary and this was a waste of time, right? I'm frustrated, like all of that. But ultimately, it probably did help. It didn't help in the way that they envisioned or intended, but I do have a feeling that it helped to kind of do like a hard reset on everything and improve results overall. So all that to say, I also continued to do the acupuncture as well a few times a week. They also, for the second round, had me go on estradiol, which is an estrogen hormone, additional estrogen. And I didn't do that the first round. And then once I was doing the shots, I think it was a similar like 7, 8, it was anywhere from 7 to 10 days of injections before the procedure. And for the second round, I did a really similar process with the injectable drugs. So the Gonal F, Menopur, Cetrotide, and then we did Novarel to trigger ovulation. I don't think I did the Luperon, but I may have. I might just be forgetting exactly. And so with the second round and second procedure, same sort of thing, same process. Once you start the shots, you go in every other day or every day to do an ultrasound and to do blood work. And then you do the trigger shot. Once you do the trigger shot, you only go in for blood work. They just check your blood and then they schedule surgery. And so same sort of thing with surgery. One of my best friends drove me to and from surgery, which was super, super sweet of her. And she also made me a homemade loaf of sourdough bread. And then after surgery, we went to Trader Joe's and I picked up a bunch of snacks and just like sat on the couch all day. But the thing about the second retrieval, I woke up that day with a really bad cold. So the day I'm supposed to have surgery, I wake up with a terrible cold and I was like, fuck, I hope they let me have surgery, right? Because like, I'm pretty sure like this might be bad. I'm like, after all of this, like, I hope they don't have to reschedule because I'm like, definitely feel sick. Like, it wasn't just like sniffles. Like, I felt like I had a bad cold. And so once I go in, and again, same sort of thing, like lovely staff, lovely nurses, anesthesiologist was great. And when he came over to me, I was like, hey, I just want to let you know, I woke up today with a pretty bad cold. Like, I don't know if that affects anything, but I want to let you know since you're like in charge of drugging me. And he was like, totally fine. Don't worry. I was like, okay, great. I was really scared that you guys would have to like reschedule surgery or something. Like, he's like, no, you're good. And I think I told Dr. Danzer that as well. So with the second round, we ended up getting 9 healthy eggs out and into the freezer. 9, which is amazing, which brings my total eggs in the freezer to 15, right? And so with the second round, we started with 18 eggs and 9 of those were healthy enough to go into the freezer. So round 1 started with 15 follicles and 6 healthy eggs went into the freezer from that batch, which is 40%. And then round 2, we started with 18 follicles and then put 9 healthy eggs into the freezer. So that is 50%, right? So the second round, we got 50% of the eggs in the freezer based on the original number of follicles. And that 50% was a lot more than the initial, right? So we did a lot better the second round. Second round, like I said, 9 eggs compared to 6 eggs, but ultimately bringing me to a total of 15 healthy eggs in the freezer. And based on the calculations, again, same sort of thing. Dr. Danzer call me and be like, all right, surgery went really great. Here's what we got. And I love that he would say too, like, okay, we got out this many, and upon looking at each one under the microscope and everything like that, this is how many were healthy enough to be frozen. And so with that number, 15 total in the freezer, that brought my chances of a live birth to 75%. And obviously that's not like a guaranteed thing, but that does make me feel so much better. And I forget exactly what it was. So if I had gotten 6 more, right? If I do another round and I get 6 more eggs, which based on round 1, right? Round 1, I got 6 and round 2, I got 9, right? So if I got 6 more, which seems very likely based on round 1 and round 2, that would bring my total to 21 eggs, which would bring me to 85%, right? So 6 more would increase my chances 10%. So after all of that, right, with a 75% chance of a live birth, that to me felt really good. That felt really good. I still have incredible health insurance coverage. So there is a part of me that's like, hey, you know what? Like, if I feel like it, I can absolutely do another round just to bring those numbers up. But for me, 75%, even though that technically is a C plus, right? That's not a guarantee by any means. And I understand that. That feels so much better than a 35% chance, right? And something that I feel much more confident in as a backup plan. And so with the retrieval surgery, I already mentioned, like, you need someone to drive you there and back. Like, it's pretty straightforward. While yes, it is invasive and you go under general anesthesia, so you're completely out, in your entire body completely out. There's no stitches or incisions or anything like that need to be made, right? It's for a surgery, like it's a very, I don't know, I think a gentle kind of surgery, or as minimally invasive as it can be. And once you're done, like I was a little groggy after surgery just because you've been under. But then once I was home, like the full day afterwards, I just hung out on the couch and relaxed. I didn't like have cramping. I didn't feel sick, anything like that. Though, obviously, I told you the second round, I did have a pretty bad cold that day. And so I spent a few days on the couch after that because I just got hit with a really bad cold. But the recovery after the procedure was actually quite easy. Like, I recommend clearing your a day or two so that you can make sure you have plenty of rest, minimal activity, all of that. But I felt really good. I felt really good the same day. I did want to rest a lot the same day, but like the next day felt very like much myself, right? There might be some tenderness or anything like that, but it wasn't some big thing that I felt like I needed to recover from. But I would say, like, take it easy for a couple days, make sure your schedule is really light, all of that. I went back to like gentle workouts within a few days. You might have some spotting. I don't even remember if I did. I don't think I did. And like, you're supposed to avoid sex or penetration for at least a few days, usually a week, though again, like every doctor might have a different recommendation on that. And as far as like how the experience was for me, like body, mind, all of that, while I was, as I mentioned, when I did the birth control, I was definitely a bit more sensitive emotionally. And once I started the hormone injections, it wasn't a big dramatic shift. Like I felt very myself. I felt very good. I was slightly more sensitive, slightly more like tender emotionally, but nothing crazy. Toward the end, I started noticing that more. And it was really funny because when I went in for acupuncture the first time, like toward the end of it, because I was dating, like going on dates and stuff like that, Dr. Schulman was like, there was a certain point she was like, okay, you have to stop going on dates. She's like, you're on so many hormones right now and your body is literally, and I said, I was like, oh yeah, my body's trying to have a baby really bad right now. So that makes sense. She's like, no, your body's trying to have 20 babies right now. She's like, so take some time off of dating because I don't want you to, feel a certain way that might be influenced because of all these hormones that you're on and because of how your body's feeling. So like take a little dating break for like the next week or two, right? Or the next week, just while you're all amped up on these hormones so that they're not impacting your brain. And I'm like, this is good advice. Thank you. I didn't think of it that way. I'm like, I feel pretty normal. She's like, no. Even if you feel normal, just take this advice. I'm like, okay, great idea. So toward the end, I felt a little more tender emotionally. I don't know that I was feeling fatigue or anything like that. I don't really remember. I did, as things started getting closer to the retrieval procedure and like further into the injections, I did notice some bloating in my abdomen, including after the procedure. And I did toward the end notice some water retention and things like that, just feeling a little bit bloated. Though I will say, like, it took me about a month for my body to feel back to normal, right? For that like water retention and bloating to feel like it was gone. So the like kind of bouncing back timeline was longer than the like drug timeline for the most part. The first round, my cycle came back quite normally. And again, you're only doing this for a short period of time, so it shouldn't really throw off your menstrual cycle that much. However, the second time, because I did that month of birth control and had like my normal period, but then my period was over, but then it came back, like it was really weird. I had like 2 periods in 1 month, which was really not cool. And so after the second round, my body was thrown off a bit more and definitely like feeling puffy, like again, water retention, bloating, that just felt a little bit stronger, if you will. And it took several months for my cycle to go back to normal. So I used to bleed close to or on the new moon. So what that is what we would call a white moon cycle. So if you have your period on the new moon, that's a white moon cycle. If you have your period on the full moon, that is a red moon cycle. And most women, if you're not using some form of birth control or like hormonal manipulation, right? So if you are just like out here freely operating in your body, right, without like the birth control pill or injections or anything like that, most women are going to sync up with the moon in one of those ways, either bleeding with the full moon or bleeding with the new moon. That's generally how most women's bodies are going to naturally fall. And so, like I said, for me, I bleed on the new moon, ovulate on the full moon. And after the first round, I went back to that schedule pretty quickly. But with the second round, because we did so much more hormone stuff that just was like kind of all over the place, that threw things off a lot more. And so it took a few months for my body to sync back up with that cycle. And that's actually how I am again. So I'm back to that cycle of bleeding with the new moon and ovulating with the full moon, which feels really good. And so that's ultimately my whole experience and process. I know this was a long episode, but I also know that I've been asked so many of these questions so much. And while my experience was very unique to me, I know that this is going to be helpful for people. And also I got a few questions from people on Instagram when I said that I was going to be recording this episode. So I just want to make sure that I answered all of those. So it says, before starting, did it help me feel better about the dreaded ticking clock? Yes, absolutely. And I will say too, because it has been, so I did the second round earlier this year, and I still feel so much more peace and groundedness with that. And even though, yes, I would love to be in a committed relationship with my life partner, I would love to be starting a family, all of that right now, I don't feel like I'm in a rush to like search for somebody. Right? Like, and here's the thing, like I am open and available for dating, going on dates, all of that. So it's not like I'm not like, the process is happening. We are doing the things, right? But I don't feel like I'm like in this desperate search to like find my person now. Like there was before this energy of like, oh, I better meet my future husband as soon as possible because I'm going to need to have babies, right? Which is not the energy that you want to date in. And it's also not the energy that someone wants to date you in, right? So yes, it absolutely helped with the ticking clock. It's funny because I've had conversations with a male friend of mine who we dated a little bit and then very quickly determined that that there just isn't enough aligned for what we want in our lives to pursue a relationship. And he'd say things like, well, have you met your man yet? And I'm like, and I actually at one point told him, I was like, why are you so concerned about this? You keep asking me about this. And I'm like, why is this such a worry for you? Because you're the one that keeps bringing up my ticking clock. And also like, I respectfully was like, you need to like, shut the fuck up about this a little bit. Thank you very much. Right? Like, why is this a concern for you? You know? And I was like, I've done egg freezing and like, that helps me feel a lot of peace of mind around this because I'm not in some rush to like be like out there like desperately trying to find a man who wants to marry me and have babies with me, right? Like I feel very good in this and with how things are working out for me. And he was like, yeah, but you don't want to like, sure, you can still get pregnant like when you're older, but you don't want to be like raising a kid when you're super old. I'm like, bro, I'm not that old. Like, calm down. Like, it's fine. Like, I appreciate you're so concerned about this. And like, it's okay. It's okay. Thank you. And I think I told him, I was like, you don't need to ask me about this anymore. It's fine. So yeah, it did help me with the ticking clock concerns. And I still very much feel like when I do meet the person that I want to start a family with, that I don't think I'm going to need to use those eggs to get pregnant my first time and maybe not even my second. So, but it does very much give me so much peace of mind. So I'm very happy that I did it. I'm very happy I did it. Pros and cons for me and my experience. I think I shared a lot of that. Like, con is, yes, mine was almost completely covered by insurance, and it still is not a cheap thing to do. Another con is that you are manipulating your body with hormones, which does take time to get back to feeling normal. And everyone's going to have a different reaction to the hormones. Thankfully, my reaction and my experience was very smooth, very easy. Other cons, like it is definitely a like time-consuming thing to be going to so many doctor's appointments and all of that. Another con could be, oh, and I actually didn't talk about this, is like giving yourself the injection. So I did all my own injections. I had never done that before. I'd never given myself an injection. I had never even given another person an injection. So I thought that was going to be really hard. It was actually very easy. Like it ended up being very easy, very painless. You hardly feel them. There's like one or two injections that kind of like burn a little bit. The medication burns a little bit once it's in there, but it was just kind of like a hot, itchy feeling. But like the needles, like it wasn't a painful thing. Like I really didn't mind the injection process of very like tiny needles. But if you're really uncomfortable with needles, that could be a con for you with injecting yourself. So you may want somebody to do the injections for you so you don't have to do it to yourself. You don't have to look at it. And I would say those are kind of the cons of it. Pros, like I said, like my body responded very well. Obviously, like the birth control thing, my body did not respond the way that they wanted. But aside from that, like with all the injections, my body responded really, really well. My body responded really well to it. I loved the acupuncture. I absolutely loved everybody involved in the process. The entire team at SCRC, like everyone was really, really wonderful and very efficient, very effective. They call you with any questions. Like also with the injections and everything like that, they call you to tell you like, hey, here's the medication you're going to be on. Here's how you do it. Right. And so I would like go get the medication and so my insurance and like the pharmacy they work with to get you the medication, it would just get delivered to my house, which was really nice. There was once when I had to go pick it up, which was kind of a pain in the ass, but it would just get delivered to my house, which is so cool, right? So convenient. And so once the medication came, I could either call the office, right? Call the center, the clinic, or they would call me and go through like, okay, here's how you do this. You're going to mix this one with this one, right? And there are really, really easy, and this was with Progeny at least, which was again, my insurance carrier, but there were really easy, helpful videos that show you exactly step by step how to do the medication for yourself. So that was really, really easy. And okay, what do I wish I knew before? I mean, I wish I knew so many things before. I didn't know really didn't know a whole lot going in at all. I think I wish I knew the like odds, I guess. So like when I mentioned the first round, they were like, okay, this is a 35% chance of a live birth. And I was like, come again? I just did all that for AD, right? Like, I was like, this doesn't seem like a good plan. Like, this doesn't seem very positive, right? And so that's something that I wish I knew before, but it turned out really, really well. So I think it's fine, but I think most women think the process is going to be a lot worse than it is. And I also think women think that once you have some eggs in the freezer, that's a done deal. And there you go. There's your security plan, right? Your insurance plan, your backup. But it may take a few rounds, right? And I would say too, it was a lot easier than I thought it would be. So let's see what else. How invasive, painful was the process? Again, very not painful at all. The needles to give myself the injections, nothing, right? Not a problem at all. The surgery itself, you're completely out, completely under. So obviously you don't feel anything. The recovery, you're like you might be like very mildly crampy or sensitive, but like very gentle. How expensive? Already talked about that. How did the hormones affect you? Already talked about that. So that's all I got for you. So that was my experience. As I said, overall, it was an incredibly positive experience. I think I learned so much about my body, about being a woman, all of that. I absolutely loved everybody that I worked with in the process and felt so taken care of and so informed, and like I could ask anybody questions. I'm very grateful that like my insurance coverage is so great because it made the cost concern, almost nothing, right? And so like overall, like I'm incredibly happy that I did it. It makes me have so much more peace of mind as I'm navigating my journey and making sure that I find a partner that I want to be with, who is really a great fit for me and will be a great parent and a great partner, right? I don't feel like I'm in some rush. Like, as eager as I am for that to happen, I don't feel like I'm in some like race against the clock to force it to happen at all. And also, like, I wouldn't be against doing another round to bring those numbers up even higher, but I do feel really good about where things are at now. And so I would say, like, if you have any questions about this, I would absolutely encourage you to talk to your doctor about it. Like I said, highly recommend, if you're in the LA area, I highly recommend my OBGYN, Dr. Shamsa Amersi. I highly recommend the team at Southern California Reproductive Center, specifically Dr. Hal Danzer. I highly recommend Dr. Jennifer Schulman, who's the acupuncturist at SCRC. And if you have any specific questions for me about my journey, process, anything like that, I'm absolutely available to answer any questions that you have. So thank you so much for tuning in. I hope this was supportive.